Okay, I want to ask a question about ambulance service here coming onto health. So this was a story in the Plymouth Live. Torpoint woman died after 7-hour ambulance wait. Now this was an inquest into her death, and the subhead says worried partner of Anne-Marie Humphreys had called for paramedics, but it did not arrive until much later. An inquest heard. That's their words. So let's look at what it says here. The opening statement in the inquest reveals the circumstances surrounding the sad passing of Anne, noting, quote, Anne's partner had called an ambulance to attend the family home. Annie had vomited blood and was becoming very short of breath. Unfortunately, an ambulance did not attend for approximately 7 hours after the initial call. A first responder had attended and had also called for assistance. On arrival at Derriford Hospital, Annie underwent emergency treatment, but despite best efforts, she sadly died. There are no suspicious circumstances. Well, the article then went on to say this, and this is what I'm really questioning here. Mrs. Archer noted that on the present evidence, that Mrs. Archer was the coroner, that on present evidence, the medical cause of death was ascertained as ischemic hepatitis, and esophageal and variceal hemorrhage, liver cirrhosis due to alcohol-related liver disease. So there's clearly a lifestyle issue here, and my question is had this anything to do with the late arrival of the ambulance? I'm not saying it had. I'm asking the question, and I think we do need an answer to this, because, of course, the issue of people's lifestyle choices have been increasingly an issue of whether they're going to get any medical treatment or not. Now, the headlines that we've seen, such as this one, should access to NHS service be contingent on a person's vaccination status? This was in nurses.co.uk. We saw headlines like this during the COVID pandemic, but actually this went on for long before that. This is the Independent. NHS under fire after announcing obese patients will not get non-urgent surgery until they lose weight. And another one here, this is from, I think it was from AP originally, but in UK survey, doctors support denying treatment to smokers and the obese. And actually this was from 2012. So this idea of withholding treatment for anybody who's made the wrong kind of lifestyle choice as far as the authorities are concerned is one that has been around. And although the headlines up to this point have been very keen to make sure that that was understood to be for non-urgent or non-emergency treatment, my question then is, has this been rolled out for maybe the prioritization of ambulance service? And then the question is, what happens when this becomes an issue for artificial intelligence? So here is the Building Better Healthcare website saying struggling ambulance services ignoring the potential of AI to relieve pressures. This is from August 2022. And they're highlighting that some agencies, some ambulance areas aren't considering the use of AI, and maybe they should be. And this pressure is starting to build. This is healthcare website, how tech-enhanced call handling can help ambulance services. So we've got a problem with ambulance services. We need to bring AI in to solve the problem. And this is Forbes, how NHS 111 London is using AI to ensure patients get the care they need urgently. So my question really is, what happens once we move towards this removal of human decision-making over prioritization? That's one question. And the other question is, has that already happened? Or has the question of lifestyle already been brought into the decision-making process for ambulances?
Via the AI?
Well, not at this stage, because it hasn't been widely rolled out. But is that, in fact, already be the case? And will that be rolled into the AI models that are being used? So I think we've got some serious questions to ask about that.
Indeed. And of course, the humanity is going out of the system very fast indeed. I think we're